Welcome to the training presentation on Calibra. The Calibra product range comprises several dental resin cements indicated for permanent placement of indirect restorations. This training presentation will help you to understand the basic concepts of indirect restorations as relevant for selling dental cements. You will also learn about the features and benefits of the various Calibra cements and how to sell them effectively. This training presentation is split in 3 sections. Firstly, you will hear about dental cements in general and what they are used for. You will learn which factors impact the choice of the right cement and what types of restorations are available. You can skip this section of the presentation if you already feel comfortable with the basic concepts of indirect restorations and dental cements. Secondly, the impact of adhesion and cementation success on the modern practice will be discussed. We will be reviewing financial and clinical insights around the cementation procedure. Thirdly, the features and benefits of Calibra resin cements will be introduced. You will learn about how to probe around related customer needs. We will begin with some basic aspects on the subject of dental cements. What are cements used for? What types of cement are there, and which factors are decisive for the use of a specific type of cement? What are indirect restorations, and how can they be reliably bonded with the tooth structure? Which curing mode works best for which situation? How should the restoration and tooth structure be conditioned to ensure successful cementation? These and other fundamental questions should be answered in the following. So why do dentists need cements at all? And what exactly is an indirect restoration? Indirect restoration of a tooth is necessary if its crown is so severely destroyed, for example due to caries, that the defect can no longer be treated with a filling fabricated directly in the oral cavity by the dentist. Instead, an artificial dental crown, custom fabricated extraorally, is cemented on the tooth. Dental cements must ensure a permanent bond between the tooth and restoration, as well as the tight seal of the tooth structure. For a long time, restorations fabricated using precious metal, such as a gold crown, were the standard restoration in such cases. Nowadays, patients increasingly request white restorations. This can be achieved by fitting ceramic restorations. Differentiation is made between all ceramic and porcelain fused to metal, which means restorations where porcelain is added to a metal base. Porcelain veneered restorations, particularly all ceramic restorations, integrate very effectively in the surrounding dental arch, and are therefore vastly superior to metal restorations with regard to the aesthetics. With all ceramic restorations, the cement used can have an effect on the overall aesthetic result, as the color of the cement can be seen through the ceramic. The following video illustrates an example of the luting procedure of an all-ceramic single crown using a self-adhesive cement. In this video, a patient receives a full ceramic crown, which is placed using Dentsply Sirona's Calibra Universal. First, the provisional crown is removed. Much of the cement remains inside the provisional, which facilitates cleaning of the prepared tooth. After ensuring proper fit and occlusion, Calibra Universal is applied to the entire internal surface of the final full ceramic crown. After placement of the crown, excess Calibra resin cement can be light cured for up to 10 seconds overall to reach a so-called gel phase. In their gel phase, Calibra cements are very easy to clean up. Their wide tack cure window is one of the most important features of the Calibra product range. It is not only single teeth that have to be restored indirectly. If teeth are completely missing, a gap is created in the dental arch. Fabrication of a fixed partial denture may be necessary in such cases. FPDs are also luted using dental cements. In these pictures, you will see a case presented that makes it necessary to fabricate an FPD in the upper and lower jaws. In the following, the principal treatment procedure will be briefly described using the example of the present case. Firstly, the teeth supporting the FPD, the so-called abutment teeth, are prepared by the dentist. This is also called a preparation. A provisional restoration is then fabricated to bridge the time between sessions. Provisional cements are used for this. Provisional cements, however, are not a subject of this training course. The fit for the restoration is checked at the so-called framework try-in. All ceramic zirconia FPD frameworks are shown here. The porcelain veneered restoration is then permanently fitted. A full range of different luting cements is available for permanent luting of restorations. But what is the correct cement? The choice of cements depends on three important factors. Firstly, on the properties of the different cements. Secondly, on the individual clinical situation. Thirdly, on the restoration, or more precisely, on the material used for fabricating the restoration. The choice of cement is derived from the interplay of these three factors. We will discuss these factors in the following to allow you to understand when a particular type of cement should be used. Firstly, let's take a look at the different commercially available cements and their characteristics. Basically, a differentiation is made between powder liquid cements and modern resin cements. Conventional powder liquid cements are mixed manually. Examples include zinc phosphate cements, such as the Dentsply Sirona product D-Tray Zinc, or also glass ionomer cements, such as Aqua Cem. Conventional powder liquid cements set purely chemically. Furthermore, there are some powder liquid cements that also have an additional resin component and not only set chemically, but can also be light cured. These products are also often available in Automix prescriptions. On the other hand, purely resin cements are available to dentists. Resin cements are a new development. They polymerize, which means harden, with few exceptions, dually, meaning both chemically and also under exposure to light of a suitable wavelength. Differentiation is made in the resin cement group between adhesive cements and self-adhesive cements. The term adhesive cement indicates that this type of cement should be used in combination with an adhesive, for example, Prime and Bond Elect, to achieve the greatest possible bond to the tooth. In this case, Dentsply Sirona provides the product Calibra Cements and Calibra Veneer. In contrast, the latest resin cements are self-adhesive, meaning they bond by themselves to the tooth, making them very easy to use. Dentsply Sirona supplies the product Calibra Universal here. This presentation gives the names of different competitor products from different cement categories. Well-known brands in the powder liquid cements sector are Fuji and Kitac Cem. Key competitors from the adhesive resin cement category are Reliax Ultimate, Multilink Automix, and Nexus NX3. Reliax Unicem and Maxem Elite are key competitor products for self-adhesive resin cements. What are the advantages and disadvantages of powder liquid cements? Powder liquid cements only have moderate aesthetic properties. They are often only available in a few tooth shades or are simply gray. This can be important in combination with all ceramic restorations, as the cement layer can affect the overall aesthetic impression of the restoration, for example, that of an all-ceramic crown. In addition, powder liquid cements only bond moderately well to the tooth. We will come back to this characteristic again later. A big advantage of powder liquid cements is their tolerance to saliva or blood. If dentists have difficulty keeping the tooth to be treated dry during the cementation procedure, as seen in this picture, a powder liquid cement is then indicated. Resin cements cannot be used in such situations. Let us now turn to resin cements. A disadvantage of resin cements, regardless of whether the adhesive or self-adhesive type, is their moisture sensitivity. The treatment site should be effectively protected from saliva or blood exposure, when using resin cements for fitting restorations. In the case shown, the site is protected by applying a rubber dam. If the treatment site cannot be protected from moisture, a powder liquid cement must be used. On the other hand, resin cements generally have outstanding aesthetic properties. They are mostly available in many natural tooth shades. More importantly than their aesthetic properties, however, is their effective bond to the tooth. Resin cements bond reliably with the tooth structure. Adhesive cements bond even more effectively than self-adhesive cements. Both properties are indispensable for highly aesthetic, relatively translucent, all-ceramic restorations, as shown here, and are frequently used for treating single teeth. Powder liquid cements are contraindicated in this case. In summary, it can be said that powder liquid cements on the one hand and resin cements on the other hand have diametrically opposed characteristics. Resin cements have ideal aesthetic properties and high bond strengths, but don't tolerate moisture. Powder liquid cements behave in exactly the opposite way. Resin cements are practically divided according to the type of bond and curing mechanism. Calibra cements from dense ply Sirona can be considered as representative hereby. The products Calibra Veneer and Calibra Ceram are used in combination with an adhesive, for example, Prime and Bond. In contrast, Calibra Universal is a self-adhesive cement, which means it bonds by itself to the tooth, making its clinical application particularly easy. Calibra Veneer is only light-cured. Calibra Ceram and Calibra Universal, however, are so-called dual curing cements. This means that they can be both chemically cured as well as light cured. Two components are always required for chemical curing that must come into contact with one another to activate the curing mechanism. You can recognize that a cement can at least be chemically cured by the fact that it is supplied in the double barrel presentation. As said, you will find the same variety of curing modes and adhesive mechanisms among competitor products. Let us now take a look at the important clinical situations that influence selection of the cement. You have already got to know an important aspect that influences selection of the cement, namely protection of the tooth to be treated against contamination with saliva or blood. If a tooth cannot be kept dry during the cementation procedure, a powder liquid cement is then indicated. However, this is not the only factor to be taken into consideration. An important factor for selection of the cement is also how much retention is available to ensure anchorage of the restoration. Two aspects are decisive in this case. Firstly, the conicity of the preparation, meaning the angle formed by the prepared surfaces of the tooth to the tooth axis, and secondly, the retention surface available, which essentially depends on the length of the tooth crown. A prepared tooth with a minimum residual crown height of 4 mm and conicity of no greater than 20 degrees is considered adequately retentive. In such situations, the use of powder liquid or self-adhesive resin cements is the standard of care. For shorter residual crown heights or more pronounced conicity, an adhesive resin cement such as Calibra Ceram should be used to ensure highest possible adhesion and thus permanent retention of the restoration. Here are some examples of this. The anterior preparation shown in this picture has adequate retention. The conicity is approximately 10 degrees to the tooth axis, and the tooth crown is sufficiently long. Dense ply Sirona recommends using Calibra Universal in this situation. Here, a second preparation for comparison. The preparation is highly conical. The use of the adhesive resin cement, Calibra Ceram, is recommended in this case to maximize the bond to the tooth. A crown fitted using powder liquid cement would de-cement after a short time in situ, meaning it would become detached from the tooth. Another example illustrates the influence of different lengths of crown. This patient only has a very short clinical crown. After preparation, the retention surface available is minimal. Adhesive cement should also be used in this case. Inlays, onlays, and partial crowns also only have little retention surface. Here, Dentsply Sirona also recommends using Prime and Bond in combination with Calibra Ceram for cementation. Veneers are used for aesthetic correction of anterior teeth. Very often, they are made from silicate ceramic. Veneer preparations also offer only little retention surface. Adhesive cementation with Calibra veneer is recommended. We will now look at the third and final factor which influences selection of the correct cement: the type of restoration and the material from which the restoration is fabricated. Source materials for fabricating fixed partial denture restorations are on the one hand precious or non-precious metal alloys, and on the other hand ceramics. A crown or FPD can either be fabricated solely using metal or ceramic. Both materials can, however, also be combined. These are then referred to as metal ceramic or porcelain fused to metal. The framework of a porcelain fused to metal restoration is cast in metal and then veneered with porcelain. To what extent does the material used for fabricating a crown or FPD play a role with regard to the cement to be used? For this, it is important to be aware that certain ceramics only have low flexural strengths, as shown in this animation. It could also be said that they are brittle. Corresponding all-ceramic restorations can therefore already fracture with comparatively low masticatory forces. One of the main objectives of an adhesive resin cement is to prevent this. There is an almost incalculable number of ceramics available on the dental market. Which of these ceramics have a low flexure strength and which a high? Which must be luted using an adhesive cement and which not? Fortunately, the majority of products can be divided into only two groups. Either the product is a so-called silicate ceramic or an oxide ceramic. Silicate ceramics are popular due to their outstanding aesthetic properties. They are mainly used for restoration of single teeth. Unfortunately, they are mainly brittle and therefore fracture easily. For this reason, they must be cemented using an adhesive resin cement. Oxide ceramics, in contrast, are exceptionally fracture resistant and thus are used as a base material for FPD frameworks. They don't require any additional stabilization from a resin cement. However, they are relatively opaque and integrate less effectively in the surrounding tooth structure. The product Zircon, a high-strength zirconia ceramic, is an example of an oxide ceramic from Dentsply Sirona. By the way, when talking to dentists, you will often hear the term glass ceramic, which many all-ceramic restorations are made of. Do not be confused. Glass ceramic belongs to the group of silicate ceramics. Silicate and glass ceramics also include more recent product developments, which are characterized by their higher strength. For example, the products Celtra Duo and Celtra Press from Dentsply Sirona. Celtra Duo has a flexural strength of 370 megapascals after glaze firing, indicated by the flame symbol. The pressable ceramic Celtra Press over 500 MPa. Small FPDs can even be fabricated using Celtra Press. One final aspect that we have to shed light on, in the truest sense, is the curing mechanism of the different Calibra composite cements. Silicate ceramics are basically translucent. Both the resin cement and also adhesive used can therefore be light cured through the restoration. However, the opacity increases with the wall thickness of the restoration. Use of the dual curing Calibra Ceram is recommended to ensure that the cement layer is always adequately cured. Zirconia and metal ceramics, on the other hand, are mostly or completely opaque and must consequently always be luted using a dual curing cement. Calibra Universal is a suitable cement for this purpose. provided the preparation is sufficiently retentive. Calibra Ceram should be used with a non-retentive preparation. Here, both types of restoration are again shown in cross-section. You can see the low translucency of the zirconia and metal bases of the restorations. The complete opposite is true with veneers, which are used for aesthetic correction of anterior teeth. Veneers must always be placed adhesively. As veneers are very thin and highly translucent, Calibra veneer cement can be very easily light-cured through the veneer. Calibra veneer is thus a purely light-curing cement. Purely light-curing cements are also less susceptible to discoloration in the long term, which is particularly beneficial with aesthetically demanding anterior restorations. Prior to the cementation, pre-treatment of the restoration surface is still common sense and shall be briefly discussed below. We will then look at the actual cementation process. The surface of silicate ceramic restorations is conditioned using hydrofluoric acid before fitting to maximize the bond of the resin cement to the ceramic. Firstly, hydrofluoric acid is applied to the inner surface of the restoration in a concentration according to the manufacturer's specifications, and rinsed off using water after a few seconds reaction time. Etching produces microscopic roughness on the surface of the ceramic, so that the cement can bond better with the surface. Salinization of the silicate ceramic surface is then recommended. Silanes bond the ceramic surface chemically to the resin cement, enhancing the bond. Dentsply Sirona provides such a silane bonding agent under the brand name Calibra. Surface treatment methods used for resin bonding to silica ceramics are not reliable for zirconia ceramics. Instead, sandblasting is recommended to achieve surface roughness. The procedure is typically carried out by a dental technician using a sandblasting chamber, like the one shown in this picture. This is an overview of the entire cementing procedure for silicate ceramic. Firstly, the surface of the restoration is etched using hydrofluoric acid. The surface of the tooth structure is etched using phosphoric acid. Both acids are rinsed off after a few seconds reaction time. Silane is then applied to the ceramic and prime and bond applied to the tooth surface. The solvent of the adhesive is air-dried. The adhesive layer must be light-cured right after application if the wall thickness of the ceramic exceeds 2.5 millimeters. The surfaces of the tooth and ceramic are now coated with resin cement, and the restoration placed in position. The cement is then light-cured 20 seconds from each direction: buccal, lingual, and occlusal. This table once again shows an overview of what has been learned. Celtra Duo, a silicate or glass ceramic, should be etched, silanized, and adhesively luted. Sandblasting is suitable for Cerex zirconia, an oxide ceramic. Because of its high flexural strength, adhesive is not required for luting. In this case, Dentsply Sirona recommends Calibra Universal. Powder liquid cements are frequently used in the dental office. Please keep in mind that there is no need to be concerned about light curing the prime and bond adhesive layer impacting fit of indirect restorations. Prime and bond has a very low film thickness of less than 10 micrometers. Let us summarize what you have learned. Please note the following. There are powder liquid and resin cements. There are adhesive and self-adhesive resin cements. Resin cements are contraindicated in cases where the preparation has been contaminated with blood or saliva. Powder liquid cements are contraindicated for restorations with low flexural strength. Single, all-ceramic crowns are typically placed with prime and bond active and Calibra Ceram. because they are made from lower strength materials. In the case of highly resistant all-ceramic crowns, or FPDs made of Celtra Duo or Celtra Press, as well as zirconia or metal alloys, the choice of cement depends on the preparation shape. In the case of retentive preparations, Calibra Universal can be used. Calibra Universal is recommended for cementing posts. Inlays and onlays should always be cemented with Prime and Bond Active and Calibra Ceram. Veneers are always used with pure light curing with Prime and Bond and Calibra veneer. Here is an alternative summary of what has been learned, this time in the form of a flowchart. With non-retentive preparations, restorations are bonded with Prime and Bond and Calibra Ceram, unless veneers are being placed. If the preparation offers sufficient retention, restorations can be bonded with Calibra Universal. This rule does not apply to all ceramic restorations with lower flexural strength. In this case, the use of Prime and Bond and Calibra Ceram is again recommended.